Hi, I'm Dr. Bill Lile and I practice obstetrics and gynecology. You might have seen in the news that comedian Amy Schumer yesterday on her Instagram post was comparing the effect of the abortion pill to just getting liposuction. Well, we'll talk about that in a second, but first of all, I didn't know who Amy Schumer was, so I pulled up some of her work on YouTube and I'm not quite sure who gave her the title of comedian, but she's not funny. In fact, most of the videos that I saw on YouTube were talking about how she had plagiarized and used jokes from other comedians. Sometimes years previously they would tell a joke and then years later she would try to make it her own and act like it was original work, and that's just plagiarism and that's not impressive at all. But also, let's talk about the abortion pill. First of all, the abortion pill is 98% successful in killing a baby in the womb up to 10 weeks gestation. You take this pill called RU46, that is the abortion pill, and it blocks a hormone called progesterone and essentially suffocates the baby there on the inside, but not by denying it of oxygen, of any kind of nutrition, suffocates the baby in the womb, and then the next day you take some additional pills which cause you to have real strong contractions to deliver the baby, the placenta, the fluid that is around. It's terrible. The Biden administration just recently relaxed safety restrictions which were placed on the abortion pill. Why were there safety restrictions on the abortion pill? Because the number one killer of women in pregnancy in the first trimester when it's pregnancy related is a ruptured ectopic pregnancy. Now, women and girls can get the abortion pill via a telemedicine visit and then have it shipped and delivered right to their home. Well, why is that bad? Well, it's bad because, number one, you're killing a baby in the inside of the womb. A baby that was created in the image of God at the moment of conception, that from that moment of conception was either going to be a little boy or a little girl, and by the time the abortion pill is used, this baby has a heartbeat, this baby is moving on the inside. But why is it also just bad medicine? Because the first priority when a woman has a positive pregnancy test is, okay, you're pregnant. Where is the pregnancy? And that's why we do an ultrasound, because 1% of the time that pregnancy is not in the lining of the uterus. Often it's in the tube, or it can be in the corneal area or in the cervix. It is an ectopic pregnancy, which means it's a pregnancy that's not where it should be. The number one killer of women pregnancy related in the first trimester is when these pregnancies, these ectopic, these tubal pregnancies rupture and women die. When a woman is denied and doesn't even have the opportunity to have an ultrasound to see the baby on the inside, but to confirm that the baby is in the lining of the uterus, she will take the abortion pill and then she will be told, you're going to have bleeding, cramping, and pain. And as opposed to an ectopic pregnancy where she will have bleeding, cramping, and pain. There already have been reported cases of women who thought that they had a pregnancy in the first trimester, ordered the abortion pill via telemedicine. It was then delivered to their home, and then they took the medicine protocol as directed and then have been found unresponsive and dead, and autopsies have shown that these were ruptured ectopic pregnancies. This is not health care. This is not good medicine. It is also going to be difficult when a state decides we want to protect the preborn in the womb, preborn that we treat as patients. Do you know we can now do blood transfusions at 18 weeks? We can do heart surgery at 22 weeks. We can do spina bifida corrective surgery, vascular surgery. If they are a patient, then they are a person. But even if a state says we want to protect the preborn who are potential patients in the womb, even if the state says you're not going to kill these babies here, it's very difficult to prevent the abortion pill from being mailed into those states. So is Amy Schumer wrong when she says that the abortion pill is really no different than having liposuction and removing some unwanted fat cells? Yeah, there's a huge difference. If Amy Schumer wants to have liposuction to remove unwanted fat cells, that's fine. God bless you. However, fat cells that have the exact same genetics as the mom are very different from a baby in the womb. which from that moment of conception is different from mom, different from dad. In fact, that baby, the chromosomes, the genetics are different from the other 7 billion people on the planet. In fact, we can do a blood test on the mom 9 weeks from the first day of the last menstrual period, which is 7 weeks after conception. We can do a blood test on the mom and we can study the genetics of this developing baby on the inside. I can screen for dozens of different conditions, and I can even tell you if this is going to be a boy or a girl way before you can tell that on ultrasound. This is a new person. This is a new person that we treat as a patient on the inside. This is not just some unwanted fat cells that Amy Schumer wants to have liposuction of. This is a new person created in the image of God. God bless you. If you have any questions, you can contact me through my website. And remember, a patient is a person no matter how small. And this little person, this little patient is very, very different from unwanted fat cells. God bless you and enjoy your day.